Hi, everyone. Welcome, welcome. My name's Lili Farhang. I'm coming to you from Human Impact Partners today. It's lovely to see several hundred of you joining. Thank you so much. As you're all kind of settling in for the next 90 minutes, maybe, grab your water, get comfortable. We're delighted to have all of you here. And I'm going to move us through the agenda for today, let you know what to expect, introduce all of our wonderful speakers. And just to note, we are recording today's session and we will send that out afterwards with many of the materials that are shared with you today. If we can go to the next slide. Thank you. It'd be lovely if folks could introduce themselves in the chat. So if you navigate over to the chat option, just make sure that you select everyone. You'll notice you can either select host and panelists, or you can select everyone. So go ahead and select everyone and let us know your name, your location, pronouns, organizational affiliation, just where you're joining us from today. And we can see a little waterfall of who's with us.
It's like the chat may be disabled.
Yeah, I'm wondering about that. Hey, Jamie. And I think the chat function is not enabled for people to choose everyone. So I will let you work on that, which is totally fine. Thankfully, yep, thank you. I'm seeing all of that now in the Q&A. I appreciate that. So Jamie, I'm going to let you work on that, and then you can just let everyone know when that is back on. And I'll let you know just your video is on also, just so you know. Awesome. Thanks, everyone. Sorry for the... Oh, here we go. Yay. Way to go, sorting it out in real time. I'm sure that was a moment of activation. So it's all good. Yay, look at the waterfall. So awesome. If you want to come back to the screen, the share screen, that'd be awesome, Jamie. Amazing. We've got over 400 folks here with us today. I already see some familiar faces. It's really lovely. So I'd love to just start, if that's okay, with a practice that we do here at Human Impact Partners, which is offering a land acknowledgement. Often when we do sessions in person, we name the land that we might physically be on altogether. But we think it's important, even in these virtual spaces, to offer what we call a digital land acknowledgement. And I'll read to you the land acknowledgement written by Adrian Wong of Spiderweb Show. Since our activities are shared digitally to the internet, let's also take a moment to consider the legacy of colonization embedded within the technology, structures, and ways of thinking we use every day. We are using equipment and high-speed internet not available in many Indigenous communities. Even the technologies that are central to much of the art we make leave significant carbon footprints, contributing to changing climates that disproportionately affect Indigenous people worldwide. I invite you to join us in acknowledging all this, as well as our shared responsibility to make good of this time and for each of us to consider our roles in reconciliation, decolonization, and allyship. So I deeply appreciate those words from Adrian Wong, and we can share a link in the chat. I am joining from Berkeley, California today, which is the territory of the Huichin, the original landscape of the Ohlone people. And we do invite you to support Indigenous organizations directly also, not just through land acknowledgements, which are sort of the first barest step that we can offer. Our organization contributes a land tax to 9 different communities where our staff are based, including to the Sogorea Land Trust here in Berkeley. And we would invite you to check out where you're joining us from today. And you can search for whose land you're on from a website that we'll drop into the chat in a second. Thank you for that. So a little bit about Human Partners. We're a national organization. We're based here in the Bay Area with staff across the country. Our mission is to transform the field of public health to center equity and build collective power with social justice movements. And our work is organized really into what we call houses, 3 houses of HIP. We have our policy and organizing house. We have our, which works to transform the social determinants of health through advocacy and organizing, research. And then we have our capacity building house, which works often with public health organizations and governmental public health specifically to kind of change its practices and policies and structures to integrate racial equity and health equity. And then we have our bridging team, which is where much of the work that we'll talk about today is situated, which is about trying to grow meaningful, authentic partnerships between public health and community-based organizations. And Human Impact Partners is a reporting partner on the report that will get released today. So that brings us to our goals. We are excited to release and share findings from the CDC Foundation's new report and recommendations on strengthening partnerships between health departments and community-based organizations. We're excited to explore the spectrum of community engagement to ownership framework, which is embedded in the recommendations. And we're excited to hear from a local health department and community-based organization partnership in Fairfax, Virginia, about developing and strengthening their relationships. That's what we'll do today. And just a couple housekeeping items before we introduce the speakers. The first is that if you want to chat any comments or share resources, you can navigate down to the bottom of your Zoom screen. Just make sure you're either selecting host and panelists versus everyone to make sure that your chat is directed to the right place. Would love questions, and you all have already modeled that by letting us know that the chat function was disabled earlier. To navigate to the Q&A function that's at the bottom of your screen, you can open that panel, type in your question, and that's where we'll select all panelists, type your question, and hit send. So that's just a little bit about how to communicate with all of us. Next slide, please. The last thing is that we do have live captioning available. So if you also navigate to the bottom of your screen, you should be able to click on, you can click show captions, and then you can enable, you select your language and you can enable automatic captions to come through Zoom. So that's all of the housekeeping. If you haven't had a chance to introduce yourself, please go ahead, do it in the chat. And we've got almost 500 folks here with us today, so everyone's out in full force. We're super excited to have you here. So I'm gonna just get us going and introduce all of our wonderful speakers. So as I mentioned, I'm Lili Farhang. I co-direct Human Impact Partners. We've got Dana Williamson, the National Lead for Public Health Infrastructure with Kaiser Permanente. She'll offer some welcoming remarks. We've got Asma, the Community and Public Health Partnerships Project Manager with the CDC Foundation, who'll be sharing about the report release and highlighting the methods and findings. We've got Rosa González, the founder of Facilitating Power, who'll share a bit about the spectrum of community engagement to ownership. I'm not going to do introductions for them, but we'll invite them to share a little bit about themselves. Once Dana, Asma, and Rosa speak, we're excited then to have a little fireside chat that Asma will facilitate that features the health director of Fairfax County Health Department and members of the department's Multicultural Advisory Council. And they'll kind of talk through how they embody many of the recommendations in their practice. So with that, I'm going to turn it over to Dana for some opening remarks.
Thank you, Lili. Hopefully everyone can hear me. Good morning or good afternoon, depending on where you are. My name is Dana Williamson, and I am the National Lead for Public Health Infrastructure within Community Health at Kaiser Permanente. And I'm thrilled to be here with all of you today and to have the opportunity to welcome you to this call. KP is incredibly proud to partner with CDC Foundation and Human Impact Partners on this very important and timely work focused on strengthening partnerships between public health and community-based organizations. I think all of us on this call likely saw and probably felt the consequences of our traditionally fragmented and siloed health system in this country during the recent COVID-19 pandemic. Our collective inability to quickly share data, disseminate consistent and accurate information, and easily understand the roles of the different parts of the system made it incredibly challenging to respond effectively to the public health emergency in front of us. But we also saw lots of examples of innovation and creative solutions to these challenges where public health, community-based organizations, and healthcare came together and developed ways to break down those walls and work together. And community-based organizations played such an important role in our country's response. They often stepped up to host vaccine clinics. They were pivotal in helping to build trust and disseminate important messaging, particularly to hard-to-reach communities. And they also helped individuals meet needs related to the economic and social consequences of the pandemic. So critically important partners during that time. So as the public health emergency, the formal public health emergency sort of fades into our collective memory, we want to make sure that we don't lose sight of those solutions and that we focus on really amplifying and spreading them to more places so that they become part of the ongoing fabric, of health in this country, both ahead of whatever next public health emergency is down the road, but also for the everyday work of supporting health and advancing health equity in our communities. And so it's why Kaiser Permanente is supporting this work you'll hear about today, as well as, I'll just mention briefly, participating as a founding member of the Common Health Coalition, which is working to do similar work to improve the coordination between public health and healthcare. But ultimately, breaking down the silos across all of these sectors, public health, healthcare, CBOs, and others, is so critically important going forward. And so I'm just thrilled that you'll be able to hear more today about how we can begin to collectively continue to do that together. So thank you for being here.
Thank you so much. Appreciate that, Dana. If I can now invite Asma to join us. And Jamie, if you wouldn't mind activating screen share, awesome. Thank you. Asma, I'm gonna spotlight you so you get the main stage. There we go. Yeah.
Thank you so much, Lili. Hi, everyone. My name is Asma. I'm the project manager of Community and Public Health Partnerships at the Health Equity and Strategy team within the CDC Foundation. It's so exciting to be here today and talk to you about this project that Dana just framed up for us. This is a national project that obviously is funded through the Kaiser Permanente National Community Benefit Fund at the East Bay Community Foundation. It's been ongoing for over a year, and we've engaged a lot of partnerships across the nation to inform this work. So I'm very excited to talk about that. And you can move to my next slide, please. So as Dana mentioned, the why behind this work is that while the pandemic really highlighted some of the fragmentation that has been a part of the public health system for many generations, but was really elevated in the pandemic, there was also on the flip side a lot of great stories and examples of what to do to build authentic partnerships between governmental public health, so health departments, and between community-based organizations and the communities that they serve. And so this project is really interested in elevating all of those best practices, those stories, and shaping them into some recommendations that are intended to be inclusive. They're intended to be directional. And so they really focus on emphasizing progress in making partnerships, and not necessarily, we're not going to dump 100 recommendations on you and say, pick one that you like, but we really want this to be a very holistic approach. And so I know Rosa González that we have today is going to talk a little bit more about the framework that she's developed at Facilitating Power, but that's really how we made these recommendations more directional, more so than random, so to speak. And so for my presentation today, I'll go through a little bit of the background of the project, so who we engaged, how we engaged them, how we developed the recommendations, who was involved in the report writing and development, and then I'll go through kind of the different components of the report, and we also will be launching the report as I speak to when we get to that section. Next slide, please. So a little bit about the CDC Foundation, because I know a lot of people confuse us with the CDC. We are not the same. We are partners, but we're not the same. The CDC Foundation is an independent nonprofit. We are the go-to organization authorized by Congress to mobilize philanthropy and public-private partnerships to support the CDC's critical health protection mission. And so what you see on the slide here today is our different strategies for impact, and this project really falls under integrating health equity principles into all our work, which is that top right box over there. And all that means is we really strive to support a trusted, diverse, and inclusive public health sector, to build capacity for community-based organizations, to integrate the public and private sectors to protect the health and foster well-being of communities. Next slide, please. Before jumping in, it's important to acknowledge all the partners that have been involved in this project. There's been so many of you, a lot of you are on this line today, so we really thank you. But starting at the top left with our core partners, we extend our gratitude to the Kaiser Permanente National Community Benefit Fund at the East Bay Community Foundation for its fiscal support, for its guidance, for seeding this idea. It's been wonderful to work with you all, and obviously human impact partners, so Lili, Jamie, and your team have really been key partners in guiding the development of the recommendations in the report, and obviously, as you can see, are also supporting facilitating this webinar. For our key collaborators, so these are the folks that really informed the recommendations. We had over 144 different community-based organizations and governmental health department leaders engage with us. So we thank you for trusting us with the information that you shared, confidentially, of course, but it's still your experience and it's still really valuable. And then, of course, Facilitating Power. So Rosa González is on the line with us today, who developed the framework that really helped give shape to the recommendations. And then on the right side, you'll see our national partners. We have 11 organizations who supported us by helping us to recruit all the health department and CBO leaders that we talked to our different interviews and our focus groups. And so we really thank you for your guidance as well on this project. And last but not least, the project team. So my team at the CDC Foundation have worked really, really hard on supporting me and all these partners with getting all this information together for you all. So I want to give a shout out to Alana, Sabrina, Pam, who may be on the line listening as well. Next slide, please. All right, so a little bit of an overview of our methods. We started with a comprehensive document review of over 50 documents that were really concerned with building partnerships in public health. We then transitioned into in-depth interviews. We did about 30 with CBOs and health department leaders. These were confidential, they're anonymous, and they really were to kind of gather insights about what are these partnerships looking like right now? What are some bright spots? What are some gaps? And how do we learn from that? We took those initial insights into what we call insight sessions, and those are basically focus groups where we engaged a broader base of people to make sure that the insights that we gathered from the interviews actually resonate on a larger scale. And then with all of these gathered insights and experiences, put them into a comprehensive report. And all along the way, national partners that I mentioned earlier were engaged in supporting this work. Next slide, please. So this is just a very quick map. If you're wondering who geographically we've engaged, we tried to, have as big of a spread across the nation and territories as possible. But of course, the coasts do the most, is what I always say. We always get a lot of engagement from the coast. So we just really appreciate everyone who's been engaged across the country here. Next slide, please. All right, without further ado, I'll invite whoever's sharing a link to the report to drop it in the chat, because this is a live launch of our recommendations report that you all get to look at today. Do not be alarmed by the length of this thing. I think it's about 100 pages, but the first 50 pages is really the crux of the recommendations, and the rest of it is a series of indexes or indices that are, or appendices, sorry, that really have more practice opportunities and more details about the recommendations. Next slide, please. So to get started, what we heard from our CBO and health department leaders as we talked to them is that you can't just jump into strong partnerships. There needs to be some sort of a foundation that is laid for these relationships to be built and to be sustainable. And so what that means is there are three different elements that we saw, were kind of the themes across the really strong relationships that were sustained. The first is a set of core values that both entities commit to. And I'll kind of highlight what those are in the next slide in a second. The second is aligning on a shared understanding, which we all know, even within public health, we define things differently, words matter, how we understand things matter. And so partners who did really, really well had a very aligned understanding on certain definitions. And so in the report, we offer some definitions that are related to this work as well. And then we also invite partners to assess their alignment and their preparedness for partnership. Just because you want to partner doesn't mean you're necessarily prepared to partner, and that could be due to several reasons, whether it's availability of funding or capacity, or even not the same goals that you have out of your partnership. And so a lot of our national partners that I mentioned earlier have really great tools and resources for how do you even do this kind of assessment. There are assessments you could take that are individual, that are for the partnership, that would really help see if you're aligned. Next slide, please. So I won't go into the description of all these core values, but you can see what they are on the left-hand side, and that is to seek to understand, acknowledge, shift, and share power. And when we talk about power, we also talk about the inherent gap in power between governmental entities and communities. We also talk about, how this is steeped in systems of oppression, including structural racism, sexism, ableism, and the like. And, how do you acknowledge that, and how do you seek to shift it? And then we have committing to centering community, and that's ensuring that you bring community on into any decision-making processes from the beginning. Practicing transparency and accountability, recognizing harms, both past and current, we heard was really important to rebuild and heal from them. And how do you do so? And last but not least, promoting mutual benefit and natural strengths. And that's just to say, health departments and governmental entities come with a very certain set of strengths of assets, policies, constraints. And so too with CBOs and community organizations. And so how do you ensure that you're playing to the strengths of each and not forcing one entity to do something that the other entity is better positioned to do? Next slide, please. So this is just a lovely quote from one of our CBO interviewees about centering community, and they're providing the example of what this means to them, which is if a health department, for example, is conducting a community health assessment, what is a typical practice is that they would go to their, quote, usual suspects. So who are the partners that they have engaged in the past, and that's who they would ask information from. But if you're truly centering the community that is most impacted by inequities and that needs the most support and that needs the most elevation of their voice, you need to be asking a bit harder questions, like who are the people we have not engaged before and how do we reach them? Next slide, please. So after setting the groundwork, we present a set of public health system dimensions, as we call them. These are essentially the themes that came out of those initial in-depth interviews. And essentially what they talk about is if there are opportunities for bettering these partnerships between CBOs and health departments, where would that be within the public health system, and what parts of a department can be improved to do that? And the responses almost always fell into one of these four categories, which should not surprise people on this call. So the categories are organizational culture within a health department, leadership and governance, funding and investment. So how does funding work between the two entities, and then sharing of data as well. Next slide, please. And so once we have our themes, we have our foundation set up, the next question was, so we have these set of recommendations. How do we make sure we put them in a space, in a format that is easy to see how you can make progress along them, and that is not just boundless, essentially. And so we heard about facilitating power's spectrum of community engagement to ownership through one of our CBO partners, actually, that we talked to. And they highly recommended it. And that's when we got in touch with Rosa from Facilitating Power to ask her about it. And we just found it to be extremely helpful. And I know she's going to go into it in a little bit here, so I will not step on her toes, but just a very quick snapshot of what this looks like. Essentially, on the left-hand side of the spectrum, if you are basically doing what the status quo is, so you're putting no additional intentional effort in engaging your community in your processes, you may be inadvertently, quote, ignoring them, right? Which is just making decisions without them. The next best thing is to inform community, which is that unilateral communication. And so you may be making decisions and telling them about it later. And then moving into consult, you will be actually asking for input from community, but you may or may not be actually enacting that feedback in any useful way. Involve is a step further, where you take the feedback and you do something with it. Collaborate is a bit more engaged, and so on and so forth. And really the North Star here is defer to, which is having community make decisions about their own selves, their families, their communities, and having the health department be the person that kind of acts that out. So we took all those recommendations, mapped them onto each of one of these steps. And I should say, I'll make a little disclaimer here that we recognize partnerships are not linear. It's not like you can move from 0 to 1 in a year and that's how you measure it. This is not meant to be a linear process. It's not meant to be extremely metric in that way, but it's just some guidance. And we've definitely heard of situations where a partnership may have been at a level 3 on 1 year and went back to a level 2 because of leadership change, because of, political context, because of funding, whatever it may be. And that even if there is that, I won't call it regression because, well, maybe, but if there's backwards movement along the spectrum, there are pointers that we have in the report for what you could do to address them. But the key is, as long as you have those foundational steps, which is those core values, the shared understanding, and the alignment on preparedness, then there is a way to rebuild and to progress from there. Next slide, please. And so I'll give 2 quick examples. I'm not quite sure how I am on time. Lili, feel free to yell at me. But very quick examples of what this all comes to.
Does 2 minutes work?
Perfect. Yeah. That's perfect. Thank you. Yeah. Okay, so a quick example of what this looks like. So within that funding and investments system dimension that we presented earlier, if you're at a level 2 consult with your partnership, your funding practices may look like that you provide funding or capacity building, resourcing for CBOs to engage in some consulting processes with you. You may compensate them for feedback through surveys. If you want to go a step further and progress into involve, which is step 3, you may facilitate processes to better understand barriers that your CBO partners face in securing funding. And then you could also streamline application processes for them, right, based on that feedback. And so you're taking the feedback and you're acting on it. Next slide, please. And then quickly for leadership and governance, so if you're at a level 3 involved, for instance, in your leadership and governance within the health department, you may be championing staff who do really well at community engagement by creating opportunities for those staff internally to help them lead on projects, on policies. So you're providing that kind of power shift internally. If you wanted to progress to collaborate, you could develop more intentional participatory decision-making bodies that include, leadership from all levels, and particularly from groups that have been historically excluded from decision-making processes. And then you would, of course, compensate them for their expertise and their time. Next slide, please. So very quickly, in terms of what's next, we disseminated the report today. We will have a series of quote explainer videos that walk you through some of these recommendations that we're working on. And then we'll be at several conferences this year, one of which is Nature 360 for those of you who will be there. We're also working on creating a space where health department and CBO partners can come together and pilot some of these recommendations with us. We're calling it the Community Health Action Network, so stay tuned for more information on that. And we'd love to hear from you as you hear some of these recommendations today, how you plan on using them. Feel free to reach out to us. Next slide, please. So that is all from me. Again, I wanted to thank the project team, and that includes Lili as well. You'll see a little QR code if you want to scan that and just provide your contact information. We'd be happy to keep you updated on the next steps with this project. Otherwise, thank you so much for your time and for attending today's webinar, and I'll turn it over back to Lili.
Yeah, thanks so much, Asma. I have to give you like such a round. This is the cheesy thing we do, the round of applause. I was privileged to see how much work you and your colleagues put into this at the CDC Foundation, and deeply appreciate the opportunity to support you all. So thank you.
Thank you. Likewise. Thank you so much, Lili. Appreciate
I
that.
know, I love the live release during the webinar. It really makes people who come feel like they have a leg up. So with that, I'm gonna invite Rosa to come on video, please. And thank you so much. We'll spotlight you. And we're gonna have Rosa do a little bit of a deeper dive into the spectrum that is the basis of the report. And with that, I'm gonna turn it over to you.
Thank you so much, Lili, and thank you, Asma. Yes, I am Rosa González, founder and principal at Facilitating Power. I'm really grateful to be joining you all here from Salinas, California in Monterey County, where the Ohlone Costanoa Esalen Nation continues to work to protect their ancestral burial sites and rematriate the land. We can go to the next slide. And the next one. I'm going to share a little bit more information about this tool, the Spectrum of Community Engagement to Ownership. And there is a full link. The link to the full toolkit is in the chat. I just have a few minutes now to offer some background on the framework and a little about how we are operationalizing it specifically within partnerships between public health departments and community-based organizations working for health equity. Next slide. The impetus to develop this framework came from a realization that the different interconnected challenges we're facing, such as disinvestment and inequality, lack of adequate housing, the climate crisis, food insecurity, health inequities, have a few important things in common. They are all, at least in part, the result of marginalization of certain communities. And they can't be fully addressed by community groups alone, nor by government and large NGOs alone. Government and large NGOs can't address these crises effectively without the leadership of impacted communities. And yet there's this huge gap between how grassroots community-based organizations approach community involvement and how government and large NGOs, sometimes referred to as the grass tops, approach community engagement. And this gap can create significant distrust, which limits our capacity to collaborate. So it became clear to me and to others that we needed a shared approach to transforming community engagement to be able to sufficiently meet the challenges that we face. Next slide. Here's a snapshot of the journey this framework has taken since that impetus to develop it in 2014. I did some research and looking into existing tools within public planning, and this tool is an integration of Arnstein's ladder of citizen participation, the spectrum of public participation, and wisdom from grassroots movements. We officially launched it in 2019 after that research and development, and also a piloting process in a number of localities across the country. And since then, it's been shared really widely. It's been featured in dozens of publications. And we are now providing training to support government community partnerships to work together to transform community involvement. We're documenting these partnerships and we'll be producing case studies and training curriculum that we hope will support more places in implementing the framework to fidelity. I want to point out in the next slide that the spectrum, we'll go back to the picture of the spectrum actually. That's the one. The spectrum starts with marginalization, a phase 0, the ignore stage, as a critical reminder that, as Asma was saying, this is the default stance of our current systems when it comes to communities most impacted by inequities. our systems from housing to education to public health were not originally designed to be inclusive of all people. And actually were designed in some cases to systematically disenfranchise Black, Indigenous, migrant, unhoused, disabled, queer communities. And so if we're not actively working together to break down barriers to participation with impacted communities, then we can often end up replicating and reinforcing those patterns because they're literally baked into our institutions. And then it's important that the other end of the spectrum is anchored by community ownership, because achieving more equitable outcomes is about increasing the decision-making power that impacted communities have over what we need to live and thrive. And then every stage along the spectrum between marginalization and community ownership holds keys to breaking down the barriers to participation and building our capacity for more community-driven solutions to the problems we face. Each stage also holds traps that are important to be aware of and actively avoid if we want to have more equitable processes and outcomes. And many of those are evident through the report. There are, if we go to the next slide, you'll see 4 major uses of the spectrum of community engagement to ownership. The first is as a framework for reflection and awareness raising. And you'll find an exercise in that full toolkit that you can use to facilitate dialogue among staff or between staff and community partners using prompts along the spectrum for reflection and awareness raising of the impacts of marginalization and what's needed to strengthen community involvement. The most common use of the spectrum is as an evaluation and goal setting tool. Essentially, you assess where along the spectrum community involvement currently falls and then set a goal. Where do we want community involvement to be along the spectrum within 1 year or for this given project, let's say, and then articulate together what will it take to get from here to there. That process is also described in the toolkit and best done in collaboration with community partners in the pre-planning, before a planning or decision-making process has begun. The spectrum can also be used as a process design tool. You can use prompts along each stage of the spectrum to make choices about information sharing, about how we want to consult communities in a good faith way, what inclusive decision-making will look like, how we want to collaborate with community partners, and then ways to build capacity for community ownership. And lastly, and I think most importantly, the spectrum of community engagement to ownership can serve as a developmental framework for equity-focused culture shift. Health departments can use it for long-term planning and capacity building to more authentically serve as partners with impacted communities working together to build health equity. And I think the report that the CDC is releasing, the CDC Foundation is releasing today is a wonderful guide for health departments to do just that. We'll go to the next slide. And as you embark on a long-term process like this, or even in short-term processes, one of the capacities that we encourage departments to cultivate is purpose clarity. Work together to get really clear what your driving motivation is to strengthen community involvement and cultivate meaningful community partnerships. What role do or can community partnerships play in advancing your goals as a department? So if, for example, one of our major goals is health equity, we need to get clear as a department that we're going to need to make targeted investments within communities most impacted by the inequities, and that those targeted investments must be determined through the participation and leadership of those communities. Cultivating partnerships like that may seem like more work at the outset, but in the long run may be more effective and efficient as you have the opportunity to draw on the wisdom and lived experiences of those closest to the problem to identify the most effective health equity solutions. Authentic community involvement can help maximize our local capacity to implement solutions and help to avoid unintended harm of potential policies and programs. And ultimately, working in partnership with community-based organizations can help evolve the culture of governance, as is needed to sustain more transformative solutions to persistent health inequities. And to do so, we need to understand the root causes of the problems, identify solutions that address the root causes, and work hand in hand with impacted communities to implement those solutions. And this takes innovative approaches that CBOs can play a role in helping to evolve. Go to the next slide. And this requires a shift in how we understand and wield power. One of the big barriers to authentic community involvement is the way in which dominant or command and control forms of power have become entrenched within our systems. And I think the report does a really good job of laying out examples and recommendations of what it looks like to begin to transform how we think about and wield power. When we see ourselves as more part of a change ecosystem, then we're focused less on maintaining control and more on building our shared capacity to affect the change and transformation that's needed to advance health equity solutions. Go to the next slide. We encourage health departments to take more of an ecosystem approach, seeing themselves as part of a larger ecosystem of actors that's dedicated to health equity solutions. So that aligning around shared goals that Asma was describing. Well, in an ecosystem approach, every actor has a unique role to play and seeks to play their role in equitable relationship to the other actors. So we spend less time developing and advancing our own agendas and more energy cultivating healthy relationships, aligning around shared goals, balancing power dynamics, and moving resources strategically to achieve more equitable outcomes. We'll go to the next slide. And along those lines, I'd like to encourage everyone who engages with this new report to read it through the lens of fundamental culture shift. What fundamental culture shifts in the culture of what fundamental shifts in the culture of planning, decision-making, and governance are our current public health challenges calling on us to make? When we talk about culture, we're talking about things that are happening both above and below the surface. On the surface, culture has to do with how we behave, how we communicate, the ways in which power dynamics are reinforced, the ways in which processes are designed. And all of that that's happening on the surface is rooted in precedents and unspoken norms, or the way things have always been done. Our behaviors are rooted in certain cultural values and beliefs that are baked into our systems that all stem from historical and economic patterns. We'll go to the next slide. And so it's important that we have at least somewhat of an analysis of the cultural and structural patterns that reinforce marginalization, the values, norms, beliefs, the economic and historical patterns that have served to keep certain communities at the margins and therefore disinvested in and overburdened with inequities. Go to the last slide. And so as you engage with the practices that are included in the report and notice how they advance along the spectrum, and as you listen to the stories today from Fairfax County Health Department and their Multicultural Advisory Council, I think you'll see and hear powerful examples of shifts in culture that help to foster authentic community partnerships that are so vital to the health of our communities. Thank you again for having me.
Thank you so much, Rosa. I actually had not heard you present so in depth, and so I learned a lot and feel really grateful that the work that you've done is the backbone of this new report that the CDC Foundation put out. So thank you so much for your leadership in this area and all the work that you and Monterey County did kind of at the outset to build the ideas. So with that, I'm going to invite all of our friends, Asma, and then all of our friends from Fairfax County to please turn your video on. Thank you. Oh, I love this. This is really great. And I'm gonna turn it over to Asma, who's gonna facilitate kind of a fireside chat discussion. And I will go off video right now and figure out if we can spotlight multiple people at the same time. And I think we don't need slides, Asma, right? Are we good? Awesome.
We don't,
Thank you.
yeah.
Take it away.
Thank you, Lili. Awesome. Well, hi, everybody. It's nice to see your faces again. I am so excited about this conversation that we have started to have offline, but I think we'll start with Dr. Gloria. If you could tell everyone a little bit about yourself, a little bit about Fairfax County Health Department, and a little bit about the Multicultural Advisory Council and how that all came together.
Thank you, Asma, for the opportunity to speak about the Fairfax County Health Department, where I have had the pleasure of serving as health director for over 21 years. So our department provides public health services for approximately 1.2 million residents across a 407 square mile area in Northern Virginia that includes Fairfax County, the city of Fairfax, the city of Falls Church, and the towns of Herndon, Vienna, and Clifton. The genesis of our department's community engagement efforts is rooted in emergency preparedness efforts that sprang out of lessons learned during the anthrax crisis, when our department had to operate a pod to dispense antibiotics to workers of one of the post offices in Fairfax and their downstream mail distribution partners. We quickly learned through that operation that we couldn't respond to public health emergencies without support from our community. And so we began a series of strategic planning engagements with our community providers and county agencies. And the more we planned, the more we realized that implementation of even the best laid out plans wasn't going to be successful without our residents, which then led us to what has become a 20+ year-long journey of outreach and engagement to better understand our community and learn how we can partner with them to better serve all within our diverse community. Our health department, we didn't set out to create a multicultural advisory council. We stepped out into the community simply to develop a relationship with our community. So how do we do that? We just found community events and attended those events, and in the process connected with the leaders of those events, many of whom happen to be community leaders and trusted sources for their community. So typically, at these events, when you meet you would meet other community leaders who were present. They'd invite you to their own events that were upcoming. And what we did was that we made it very, we tried to honor every invitation that we received in those days. And we're still trying to do that. We made it a priority to engage growing community partnerships and to nurture them and so on. And like all relationships that are nurtured, mutual trust was developed over time. And so 5 years later, after 5 years of engagement, we invited leaders from the 7 non-English speaking groups who make up the majority of Fairfax County's ethnic population to form the Multicultural Advisory Council of the MAC. And since 2007, so this was 2007, and since then, the MAC has grown significantly to include additional ethnic minority representation. At our last meeting a few weeks ago, I believe we had something like 50 people in attendance. And so you might be wondering, who are these people? Well, they are business, religious, and other community leaders who our department has the privilege of calling friends. They are extremely busy people, as you'll soon find out from just the small representation who's participating with us. They were really extremely busy people, but they just make the time to hang out with our health department, to learn about health issues. Over the years, they have served as a gateway for members of our outreach team to connect with our diverse communities They also have helped our outreach team relay crucial information about programs, services, and public health practice, while at the same time helping us to better understand what makes their communities tick. So there's sort of a two-way street where they are learning from us and we are learning about our community as well. Our relationship with our MAC has evolved into a reciprocal, mutually beneficial relationships that have also strengthened, the partnership amongst our community partners. So as we've engaged community and have tried to strengthen our relationship with them, because we engage together, they are also having the opportunity to strengthen their own relationships. And so it's been a win-win for our community. Together with our community partners, we are basically creating networks across our diverse communities that are critical, that we see as critical to developing sustainable solutions to public health challenges that face our diverse community. I talked a little bit about the MAC, about our outreach team. It's a team that slowly has grown over the years since we created the MAC, and consists of who we call community health specialists, who mirror the communities we're trying to reach. And that team works hand in hand with our MAC and other community partners to strengthen community involvement and strengthen our partnerships as well. And as health director, I have to tell you that it was so heartwarming to see our community partnerships on full display during the pandemic, as we leveraged over 1,000 community partners and organizations in all aspects of our department's pandemic response right from the start of the pandemic. And working together, our efforts led to equitable access to testing and vaccines across the county, and also promoted a significantly higher level of compliance with isolation and quarantine among our ethnic minority populations as compared to our white population. That's something that you would have thought would be the reverse, but actually was not. And so I can only say good things about our partnerships with our MAC. They have really, our community partnerships have really transformed the way we think in our health department, the way we do business. And it is, as I said, it's a journey that we only want to strengthen and improve as time goes on.
Thank you so much, Dr. Gloria. I think that's really valuable. And every time you talk about your partnership, I'm always impressed by the fact that you use time and engagement as currencies of your relationship. And I know, we presented, funding as a key element of something that could strengthen partnerships, but that's one currency of building trust, right? Another currency of building trust is spending time and engagement. So I love that you exemplify that. And you mentioned the outreach team. And so I'd love to turn it over to Mr. Mingo for a couple of minutes to maybe talk a little bit about the outreach activities that the department has embedded into its practices. And Mr. Mingo, you are a fan of empathy, as I remember, in the way you operate. So I'd love to hear a little bit about how that is embedded in your practice as well.
Thank you, Asma. I'd like to first start with, under the leadership of Dr. Gloria, she mentioned all the wonderful things she's done in community, but at the same time, to make that successful, she needed to also change the cultural environment within the health department over that span of years that she talked about. So one of the things that, and I give her full credit to this, is developing a culture of empathy, a culture of respect, and a culture of humility, because you need all those things to move within community in such a way where there is a mutual benefit between health department priorities and also community priorities, and to create a place of alignment around them. So what do I mean by that is give you an example in all of our internal processes, and I'll answer you more directly around the outreach team in a minute. But I think these are important as well for agency leaders that may be on this webinar. Dr. Gloria took a look at all of our internal HR processes, for an example, even down to our interviewing questions for new candidates that would be coming into the health department. She wanted to make sure that those questions reflected in such a way that it would allow us to identify those that will be empathetic, that would be respectful, that would walk in community and humility to create that change of culture that's necessary in every health department. So I definitely wanted to mention that. The other thing that I would like to mention internal organizational wise is that basically there are 4 touch points as I see it that I've been here and had the privilege to work here at the health department is I just talked about some of those internal mechanisms, but also in terms of forward thinking. So even down to we just finished the exercise of developing our 5-year strategic plan. And I will tell you, and I encourage everybody to go up on our website at Fairfax County Health Department and take a look at our strategic plan. But we went through a very comprehensive agency-wide involvement from all levels of the department. Everybody had an opportunity to have input into the genesis of the strategic plan. In that plan, things like the ability to focus on vibrant community relationships and raising the level of the importance of that. Every working group and division within the health department was really critical. And through that exercise, allowing staff, no matter where they are, all the way up to from administrative levels, all the way up to executive levels, to feel empowered to work and move in community in those ways that I talked about previously. The third element is that everywhere from the executive level down to the divisional level leadership are actively engaged in community. So they're moving outside this building, and we have a number of buildings around the county, and they're encouraged to move into community. One of the things that I would say, the first things that we do in leadership here is all new leaders that come into the health department, they work in conjunction, or we encourage them to work in conjunction with that outreach and engagement team that Dr. Gloria talked about earlier that mirror our community. Well, they are in many ways for the health department, the tip of the spear. They're the gateway of understanding. They're the gateway of communication. They're the gateway of trust. That new leadership that comes into this department can leverage that. So they are encouraged to do a community ride-along with our outreach engagement team. They are given the opportunity to receive an intensive presentation about all of our communities. And we're really diverse in Fairfax County. Dr. Gloria said 1.2 million. Well, I will tell you, we are really diverse in Fairfax County. So what that does is sets the tone and tenure and the pace for new leadership to begin the process of aligning with the vision of the established leadership that Dr. Gloria has set forward. And then the fourth thing that I would say to you is that there is active engagement at all levels of the department with organizational leaders, not just the outreach and engagement team, because they do a fantastic job, but there are other really awesome divisions in this health department that actively engage, that follow this model of active engagement in community, and they engage with leaders, but as well as community champions. And then the last thing I will say is that at the executive level of the leadership in this organization, from Dr. Gloria to her deputies, to division level folks like myself, we all recognize that we're all working upstream to really impact health improvement across all of our communities. So thank you very much.
Thank you so much, Mr. Minga. That was very valuable. And I'd love to turn it over to some of the representatives of the council that we have with us on the line for the last 10 minutes or so of this chat. But I'd love to hear from each of you. First of all, who are you? And Mr. Migo, I'm sorry I forgot to ask you to introduce yourself and your role. So you could do that as soon as I stop talking here. But would love to hear from the rest of you as well. You know, who are you? What is your role? What is the community you represent? And then what is one of the most important aspects to you of your relationship with the health department in your community? So whoever is ready to go first, please.
I am D. Robert Kennedy. Am I muted?
No, we can hear you.
Yes. And I represent Emmanuel Worship Center, one of the partners of Fairfax County. And I'm speaking not from the perspective of being an employee of the health department, but as one who has been a beneficiary of being a partner in the MAC and also in the total work that is being done through the health department. I'd like to adopt 4 words that has led me to be able to, what I have gathered as I've worked with the department. One is availability.
Mm-hmm.
The other is flexibility. The other is friendship. Did you hear the one? Friendship. And
yes.
The other is family. To me, Fairfax County Health Department has built with us as members of the community and partners in the community, the kind of family feeling that we can feel free to ask any questions and contact members of the department at any point. In addition, they have, just to illustrate, they have helped us with how to build partnerships locally, not top to bottom, but across the culture, horizontally, with other persons within the community, other organizations, other communities within the community, and have helped us with capacity building because of the fact that some of us do not have all of the resources that are necessary to be able to carry out some of the functions to help with the health questions out there, but they have helped us by even supplying us at points, human resources, particularly financial resources that have helped us to build out our capacities. And in the question of diversity, I'd like to suggest that what we have found out as we have worked, we may be called to represent one diversity, one aspect of the diversity. In my example, African Americans, but that's a totally diverse community.
Yeah.
When I say Africans, African Americans, Afro-Caribbeans, Afro this, Afro that, and Afro-Hispanics, so that we are actually working within diversities within diversities. We have learned that, I say that as partnering with Fairfax County, it helped us to open our eyes as to what were some of the significant needs. Thirdly, another example, as we did in practice our programs, like I offered what would be called Family Life Conference that around mental health. And within that conference, was able to receive the help of the county. Many members came as representatives and participants. But what we discovered, that health is not just about the health of the body, but it's about the health of the family. We discovered that one person sick in a family, the whole family actually is impacted, if I may not say sick. We also discovered that when we talk about health, at that conference, it was supposed to focus on mental health and sexual health. But we discovered that financial health and we have offered now another workshop, a series of workshops on financial health and wellness, because we discovered there that a lot of the other challenges that were beginning to impact the family and begin to impact individual health mentally were financially sourced. So those are at least 3 significant things that we have been able to come to terms with as participants from the community. I could name more, but I'm suspecting will tell other stories.
Thank you so much. Thank you. And you're getting a lot of love in the chat, by the way. A lot of people are agreeing with your points. So thank you for sharing that. I'll turn it over to Imam Naeem if you're ready.
Thank you. Thank you. Thank you for hosting this webinar. A lot of useful, beneficial information. When we, speaking of Fairfax County, and I am Naeem Beg. I work with Dar Hijra Islamic Center. It is one of the largest Islamic centers in Northern Virginia. We serve a large community here, many ethnicities, very diverse community. What I must appreciate, the team that Dr. Gloria created around herself. You know, there are certain perceptions of a public service, you know, or a bureaucracy. And I think the culture that we see here is more of a partnership, that we are members of the community, but we are playing different roles, and we are going to work together in making sure that our community is healthy, in making sure that our community benefits from the programs and services that are out there. And many times, you know, honestly, we didn't know before, oh, we can benefit from this program. And the second aspect is that the team and their availability. It's not a 9 to 5, Monday to Friday kind of team that I see. And that's really the beauty of the health department. We need them on Saturday. They say, sure, we can come on Saturday. Oh, we want a workshop on a Sunday. Sure, we can come on Sunday. And I think that's the availability, flexibility, working with you. Oh, we need something to get done. We need a seniors program. How can we do it? We are a Muslim community. There may be issues of, you know, hijab of women and all. Don't worry, we will take care of that. And then here you go, you find someone coming and speaking with the community. So I'll conclude with that. It's just it's a culture of working together for the community. That's what I would say.
That's wonderful. Thank you so much. And last but not least, Sabrina, I would love to hear from you for a couple minutes before we wrap up here.
Okay. Thank you very much to have us to be here today. My name is Sabrina Su. I'm the Deputy Executive Director for Chinese American Community Health Service. We are a group of volunteers established the Chinese American Community Health Service in 2011. Later, we become a nonprofit organization in 2017. Since 2011, we've been provide health fairs for social disadvantaged individuals in Fairfax County and the metropolitan area. Fortunately, we are a member of the Multicultural Advisory Council of the Fairfax County Health Department. We believe a good relationship between a health department and its community-based organization is built on trust, collaboration, and mutual respect. Here are some examples I can show you. Since 2011, we has consistently participated in the meetings of Fairfax County Health Department Multicultural Advisory Council. In the return, the director of Fairfax County Health Department, Dr. Gloria, has visited nearly all of our CACH's annual health fair in Fairfax since 2011. This is about 12 years consistently. Our partnership is characterized by trust, consistency, and transparent communication, and a common set of objective and vision. We aim to enhance health and well-being by engaging with the community organizations and provide assistance to local health departments and services. Our goal and vision with the health department are in harmony. Our long collaboration allows the health department and us to coordinate an emergency response effort to ensure the resources are deployed efficiently, and that vulnerable population are effectively supported. In early 2011, Catch's team up with the Fairfax County Health Department to set up a volunteer immunization clinic in 2 months to facilitate and distribution of thousands of doses of COVID-19 vaccine to our members of the community over the course of 9 events. Be leveraging exciting community network and trust relationships. This partnership help overcome barriers in access and promote health equity. We were so fortunate. Thank you.
Thank you so much. Thank you all again so much for your time and for sharing your experiences. I will turn it over to Lili because I know we're running a little over, but this was so valuable.
Okay.
Appreciate you.
Yeah, no, we're okay. Actually, everybody whose video is currently on, keep it on. And if I can invite Rosa to join us, and Dana, you're welcome also to come back on. That would be great. And I think what I would love to do, there's like so many good questions that have come in through the Q&A and come in through the chat. And so the facilitators or moderators on the back end, there's a lot of folks that are sort of supporting logistics and tech here, are answering some of the questions. So my first question really is directed, Asma, to you, and is in the context of the report and recommendations. I wonder if you can talk a little bit about, and this came up in the Q&A, and about kind of what you learned that is unique for rural environments or for more conservative political environments. I think those two things sometimes are talked about synonymously, but they actually aren't. So I think they're discrete. Rural environments are not always inherently conservative. So I think if there's some learnings that you have that you want to share, that would be really great. And I think just related to that, it's actually helpful to talk about what united all of the different localities across geography. I think sometimes we kind of focus on the differences, and actually it'd be great if you wanted to highlight what united across place that you learned.
Yeah, that's a great question.
Oh. Asma, you muted for some reason. There
Am
you
I
go.
okay now? Okay, thank
Gotcha.
you. I was saying it's a good question because we ran into an issue with this when even recruiting for our interviews and focus groups, right? There were some people who felt like they couldn't even speak out on some of these things, you know, in some politically more constrained areas, I guess. You can't even, you know, saying the word health equity is not okay. And so it was challenging to even get those conversations had. But I will say politics plays a huge role for both those things that you mentioned, Lili. We've heard from some entities that if it were not for a senator who would back a health department by giving them resources, but also signing off on a piece of legislation that would support them in having like a community outreach team or department or arm within the department, they probably wouldn't have gone as far in their community partnership building. And so I'll stress the importance of that. And we can't have this conversation without talking about the political climate and the specifics around the jurisdiction. But what we did see unified kind of across those challenges was, again, this theme that we keep coming back to and that Rosa talked about and that we saw from Fairfax as well, which is just listen to your communities and work with them. And sometimes, and I've seen this come through in other questions in the chat about funding, for instance, like funding can get really restrictive on the federal level and the state level with what you could do with it. And I think a lot of health department leaders, and people who are in public health, we get in our heads a little bit because we try to filter as much as we can. We try to make decisions quickly to support community without engaging the community to begin with, because we think we're protecting them. But What has been more helpful than that is actually inviting the community in and saying, listen, these are our restrictions right now. Here's what I can do. Here's what I cannot do. And you'd be surprised at how nimble community members are at supporting you. And so when public health was under fire, right, during the pandemic, and a lot of leaders were getting death threats, it was really the community members who went to bat for them, and they would advocate and they helped pass policies. And so this goes back to the core value that we talk about, which is relying on those mutual strengths. Do not be shy about sharing transparently what you are dealing with your community, and let them help you so that you can help them, is the message that we got over and over and over again. So I hope that's helpful.
Yeah, that was amazing. And in fact, kind of touches on some of the responses we dropped into the Q&A, kind of about how to navigate political risks and the political landscape, and the importance of actually taking time to understand that context, to actually strategically understand it, assess it, learn to navigate it, and then communicate about it with partners transparently. Sometimes those are quiet conversations, but that's okay. Rosa, I would love to just ask you, there's obviously a lot of health departments that are here, and they're dropping in great questions in the Q&A and in the chat. And a question I have for you is why do you think health departments are sort of such fertile terrain to experiment with some of these ideas? And kind of what are some of the promising things that you're seeing from health departments specifically with respect to moving through the spectrum?
Yeah, thank you. I think, part of the shifts that are needed overall across the board within our institutions are being made more evident by some of the different crises that we're facing. And so health is one of the places. Health is universal, and the health of our communities has been threatened in pretty dramatic ways. And it awakens in us our humanity, our capacity to make change within our practice. Our creativity and innovation can get sparked in times of crisis. And I'm seeing that within health departments and in other sectors as well. But public health is such this critical space of unification, and also of illuminating the kind of change that we need. And I think there are just incredible folks that get drawn to health equity and health as a focus. And so that's part of it's people that makes the ground fertile for this kind of work. And I think, Fairfax has just demonstrated so much of what I see promising. But some of the other public health departments that I'm working with right now, predominantly in different regions of California, are showing that same sort of, let's before we used to just do the research and start developing the plan, and then bring community in about midway towards the second 2/3, the second third of the process, and ask for input. And now I'm seeing more of a stepping back and saying, okay, before we actually start the process, let's focus on cultivating our relationships and identifying who are the community groups that we can partner with to carry out the research in a more participatory way, in a way that honors community wisdom and expertise. And then from there, start the planning in a collaborative way. I think that if there is one thing that people still walk away with, it's in the pre-planning, that's when we should start the relationship building. And I'm seeing that light bulb go off for a lot of folks within public health.
Thank you so much. Thank you. We had some really specific questions for Fairfax County that I think would be great if you didn't mind answering. So one question is, do you fund community partners who participate in the MAC? So I think being able to answer that would be great. Another question around whether the Fairfax Health Department or the state of Virginia has declared racism as a public health crisis, if that's created an enabling environment for you. Maybe we can spend a minute or two on those, and we're going to try to wind down before the 30-minute mark. So Dr. Gloria, Mr. Mingo. Yeah.
So Mr. Mingo and everyone else can just chime in. So the quick answer to the first question is no. Our MAC members are volunteers. And the reason that we have really, stayed away from making our relationships with our community members transactional is that it prevents that long-term engagement. I think if, when you do things transactionally, sometimes people find themselves that they have to simply because there's an incident or something's happening and you got to get people to the table and you have money to give to get the people, but it's in the sustainability. I think public health, and those of us in public health have seen our funding, go up and down, and that impacts services and programs. And community relationships are not one that you can start and stop. It might be easy on our end to start again, but it's the same people we're going to, and they get tired of starting new relationships with the government. And so we have looked at who we bring to the table. And this is I can't stress how this is a long-term relationship. It's not something that you go into to say, I need to get community together for X. When you do that, you are forced to sort of make things work quickly, and money is an incentive because we're taking their time. Every time we call for meetings, and we've had many meetings, impromptu meetings, regularly scheduled meetings, whenever we have a public health challenge that we need input, we just convene the MAC, even if it's not on their regularly scheduled time. So we see this as we see the strategy as being more of a investment in our community, to know them and they to also know us, and to give as we take from them. And that has worked perfectly. In regards to racism, this work, obviously, as time has gone on, governments have better appreciated the role of racism, structural racism on the health and well-being of their community. Fairfax County passed a One Fairfax resolution. Mr. Mingo, help me out, like what, 5, 6, 7 years ago or so? Sorry, I can't tell you the exact number of years, but it's in recent history. And so all these things are furthering our cause, right, to advance health equity. But this work started in 2001. One of the things I failed to mention, I said Fairfax County is very diverse. I didn't tell you how diverse it is. We speak over 185 languages here in Fairfax County. And so it is very challenging to promote health and well-being for all on our own. And that's why we need community, and we don't do anything without community. The other thing about engaging in community over time is you're able to assess the strengths of community. And then for areas of opportunity where, they could benefit from your partnership with them, we're able to work together to do that. And what that means is that when you are in a pinch and you need to do something, you already know how to engage community. Sabrina talked about vaccinating folks during the pandemic. It was because of 10 years of me witnessing her organization provide immunizations like flu vaccines during their health fairs, saw how elaborate their health fairs were, where they brought community providers, they brought LabCorp or some other lab entity, that I knew that organization had resources to stand on their own 2 feet. And so when we were burdened, I was able to draw them in because I knew that they weren't going to be a burden. I could just say the word, and they'll get it done. And that's exactly what they did. We used Imam Berg and his mosque, Dr. Kennedy and his church, and other people differently based on what our needs were. And those of you in public health know that our needs were multiple needs. And I talked about 1,000 partners. Each of those partners had a role to play. And it wasn't at the time of as things were unfolding that we were trying to figure out, oh, who can do what? We already knew who could do what because of a long-standing relationship with them. And that's what made the difference.
Thank you so much. We have about 2 minutes left. I'm curious, is there anyone who is here who wants to just mention something in response? Yes,
Yeah,
please.
Lili, I was going to say
Thank you.
once you as a faith-based organization, and then there's county and employees and staff, but once you start to address each other by your first names, that means there's more than this business relationship. It's friendship, and that's the beauty of this participation.
Thank you.
And Lila, if I may, just really briefly,
Yes, please.
Dr. Gloria, and I would encourage everyone to go out on the web to look up at Fairfax County website, the county website for the One Fairfax policy. But it's really integral. I talked about in kind of the layering and creating the fabric internally within our organization that Dr. Gloria talked about earlier. But understand what Dr. Gloria talked about, the shift of government. The county itself has made decisions to shift. It recognized the historical things that absolutely took place in this county with certain populations, primarily the African-American population, and then created not only policies, but then funded an office to make sure that there was adherence to those policies. So when I talked about the opportunity for empowering staff within our agency, understand that opportunity goes across the county, across county agencies, and then there's an office to hold a place of accountability of that work that should be taking place. So I just want to make sure that there's, we're talking departmentally, but it's really important to look at governmental systems and encourage governmental systems to maybe look at this framework in Fairfax County as well.
Thank you. Thank you so much. This is a perfect comment to end on. I really deeply appreciate all of you. Thank you to the many hundreds of people who joined us this morning, afternoon. Thank you to all of our speakers. Congratulations, Asma and team, on releasing the report today. Thank you so much, Dana, for the support from Kaiser Permanente, Rosa for the intellectual underpinnings of the report, Fairfax County team. You did get so much love in the chat, and I think people were really moved by the depth and strength of the relationships that you displayed here today. So with that, thank you. Thank you to Jamie, Sabrina, Clara, Alana in the background who are providing technical and logistics support. We wouldn't have been able to do it without you. Have a wonderful day, everyone. Thank you.
Thank you.
Thank you, everybody.
Thank you.